Hello, Facebook. Welcome to our first Team U Productions live event, a Q&A with Dr. Jen Meyers. I'm Trish DeMarcus, coming at you live from Dr. Jen's office here in St. George, Utah. And I am so excited to introduce you to this wonderful woman. She has really advanced the field of nutrigenomics and genetics. A little bit about me. I have had a 10-year health journey, finding answers for symptoms, going from doctor to doctor, looking for answers, and really just getting different diagnoses of they didn't really know what was wrong with me. And doctors wanted to put me on different medications, and so I went the natural route. And I found a lot of answers that way, but I was also given like 60, 70 pill bottles.
Yes.
And along the journey, I got a little bit sick when I found out that I had some genes that I had to have certain forms of vitamins that would work for my body. And so along the way, I've gotten to know Dr. Jen here and learn a little bit from her, and I'm excited to introduce you to her. So not only is she beautiful inside and out, but she is brilliant. She has 3 PhDs. She's a doctor of natural medicine, doctor of Chinese medicine. She is a functional medicine doctor. She is a geneticist, a nutrigenomic specialist.
Mm-hmm.
She's one of the most kind-hearted women I know. I see her use her resources and her talent to serve others on a daily basis. And I'm really excited to just have you here sharing your time with us. So thank you.
Aww. So Trish is going to make me cry before we even get started, everybody. So no, thank you for that. This is you are such a wonderful woman too. So it's been a pleasure getting to know you and watch you go through your journey of health and wellness and being able to understand what you need for your body, what works best for your body, and become aware. And that's a huge, huge thing. So I'm proud of you.
Thank you. I think when you give your body a voice and it gets what it needs, it can do miracles, right?
Absolutely.
Yeah. So let's start with what got you into nutrigenomics. What got you? Where did you start and what is your story?
So I'm going to try not to be long-winded here, but I started in biomedicine. I worked in obstetrics and gynecology as well as in the OR. I was a powerhouse in the OR. I loved it. I loved it. But I realized along the way that being in surgery, you can cut out everything except cause, right? Mm-hmm. So we can take out organs and we can do everything that we need to do, but there's still a problem internally, metabolically, how the cells function and how things happen that we might not always fix with surgery. There was a lot of patients who I want something more natural. Can I eat something that's going to help this? Can I take a supplement or a vitamin that's going to help this? And the problem is we just didn't know. And I remember going home at night and I'm thinking, something feels off. Something doesn't feel right. I feel like I'm missing something. I feel like it just didn't feel complete. And there were days, and I actually hate saying this, but there were days where I dreaded going to work because there were times where what are we going to do? Yeah. We didn't have time to research. You're seeing 40, 50, 60 patients a day. You're in the OR, go, and you don't get to talk to them prior to, you don't get to follow up afterwards. It just felt so impersonal, kind of cold. I don't like to use that word. We need surgery. We need surgeons, right? There's always going to be trauma. There's always going to be babies being born. There's always going to be things that we need surgery for. So I don't want to discredit that. But for me personally, I felt something was missing in healthcare. So we used to test the MTHFR gene for recurrent miscarriages. And I started to look at this gene and its pathway and its pattern one day. I must have been bored or couldn't sleep because back then I never in a million years would have thought about looking into this. And I realized within this pathway, all the things that methylation and this MTHFR gene affects. And then I also realized we were telling these women for years to take folic acid while they were pregnant, but you look at the chart and within this pathway and you see folic acid and then it converts into folinic acid and then it goes to 5-methyl-tetrahydrofolate. So it takes 7 steps to go from folic acid to the active form that gets into the cell that precurses the 250 plus biochemical processes that you do every single day.
Yeah.
And my mind went, oh, here's what we've been missing.
Mm-hmm.
So I started down the rabbit hole, and I kind of fell in love, and I really fell in love. And now I wake up every morning and I'm excited and I'm happy and I feel good when I leave the office. Are there things that I have to go back and go, okay, I gotta go back. I'm missing something. I gotta go back to the books, and I've got to go back and research. Yes, and that's the beautiful part.
Yeah.
But it's been an awakening moment. It took a personal health journey for myself as well.
Mm-hmm.
And it took about 3 years for me to finally feel well after going to doctor after doctor and having surgery. And I knew these doctors and they couldn't help me.
Yeah.
Is there something I can do besides take this pill? What can I do to make me feel better?
Right. For me, it was getting to the root cause. I felt like it got to this. It wasn't just the symptoms, it was why this was happening in my body. And you talk about MTHFR, and that was one of the first genes that I found out I had, 5 years ago. And also why I think I was getting so sick on my supplements is I had the wrong form. I had folic acid, and my body, it did not like it.
Well, it doesn't absorb it, and it builds up and it builds up and it builds up. So if it's not absorbing it, it's not getting into the cell to precursor cellular energy and all those different functions. I mean, neurotransmitter production, mitochondrial production, detoxification, inflammation and immune system. There are so many things that just that little B9 vitamin does inside our bodies. And I never realized how powerful it was. I remember, is there a vitamin I can take for this? Is there a supplement I can take for this? Is there a food I can eat? And I'm like, yeah, okay, you're sick. That's not going to work. But now I think, oh my goodness, I just want to go back and call if you're listening and you were one of those patients, I'm sorry. Well, we can do more now, right? So we can actually look and be proactive and preventative and help you become healthy and well. And that's what I love.
Yeah, and that leads me to the question, the Human Genome Project, right? That was 13 years in the making. That was mapping the entire body.
Mm-hmm.
What did we learn from that?
What are we still learning from that? That was a beautiful 13-year run. So it was 1990 to 2003, I believe, it was how long that project went on for. What it did is it helped us, yes, map sequencing of human genome, understand these genetic variants in these SNPs, and these SNPs, single nucleotide polymorphisms, right? What are those? They're these little tiny individual recipes that make us who we are. They're variations within our DNA. It's not a bad thing. It's not necessarily always a good thing, but it's what makes us who we are and what we look like. So we're looking at all these SNPs, we're looking at all this sequencing, and we're realizing within this project, it opened our eyes in the conversation to, you can affect how you feel, even with your genetic predispositions, with lifestyle, nutrition, and nutritional supplementation.
Mm-hmm. Yeah.
And it just opened up this whole new realm of medicine, of conversation, of life for most of us. Yeah, it was great.
I truly think that is where everything is going to. Like medicine is going that way. Even at the hospital here, I knew they were doing a DNA test for what kind of medications.
Oh, PGX. If you're a physician and you're listening, I would just really wish that every doctor would do PGX testing. Like I said, people are still going to have surgeries. People are still going to need biomedicine. It's just the way it is. And they complement each other very well if you allow it to. But if we can understand what type of medication to give them so that their body responds the way that it should to it, they don't have to go through all the side effects and spend all the money on, well, this didn't work and I just filled it, but now I need to take something else and spend more money. It drives up insurance costs. It drives up costs for employers. It takes money out of people's pockets and they work really hard. So it's a simple cheek swab, and it just gives some direction. I wish they would all do it.
Is that PGX testing?
PGX testing.
What is PGX testing?
Pharmacogenetics. PGX is pharmacogenetics, and what that's looking at is different forms of medication and how your body reacts to them, and which ones are going to be optimal, moderate. They'll work, but you could have side effects, and to stay away from them because you probably will have reverse or adverse reactions or side effects from it.
And so now you do the same thing in your office with nutraceuticals.
And pharmacogenetics, I will gladly run those on patients as well. I think everybody should have it because sometimes surgery and medications are necessary. But yes, I use what we call nutrigenomics, which looks at those really important nutritional pathways that affect how our biochemistry works. Everybody seems to think I can just take a multivitamin. Doesn't matter what kind, any vitamin, right? So your doctor says, you know what, I see that you have issues with cardiovascular, like blood pressure, and I see you have issues with hyperlipidemia, you have elevated cholesterol, you have elevated LDL. I'm going to put you on a statin, which, fine. That's another show topic. But I think you should take, CoQ10 as well. So they go to the store and they look at this long, huge aisle. I've been there. I'm sure you've been there. We've all been there.
Full.
And you see CoQ10, ubiquinone, ubiquinol, CoQ10 with red yeast rice, this, that, the other, and you're thinking, I have strengths, dosage, 60 milligrams, 120 milligrams, 200 milligrams, 300 milligrams. I'm just going to grab whatever. Right. You take it home, you go back in 3 to 6 months, you have your blood work done, it's exactly the same. And you think, this stuff doesn't work. Vitamins, supplements, this stuff's garbage. You probably weren't taking the right form for you and the right amount.
Exactly. That's exactly right.
That's what, it's literally that simple. And when somebody's like, well, what is the goal of nutrigenomics? The right supplement and the right amount at the right time for the right person.
Wow. It's amazing that this even exists. But, just the future of this is going to be unbelievable. So when we talk about genes and you talk about SNPs, how many SNPs are in the body?
Oh, there's right. So we have 46 pairs of chromosomes, right? So there's, they've estimated over 20,000. There's a ton of SNPs, of variations that we look at that can address, actionable versus non-actionable versus physical, right? So you take these physical SNPs and you say, okay, these are ones that show what color hair we're both going to have, what color eyes we're going to have, how tall or short we're going to be. Those are things that obviously some of us would like to change. However, we cannot unless we do that ourselves. Then there's actionable genes. These are the genes that we can affect and we can support with nutrition and nutritional supplementation. That's the stuff that we get to look at, is these little, like I said, these little individual recipes that make you who you are and how your body functions. We just do it on the nutrigenomic standpoint and the actionable standpoint, and understanding, I have the MTHFR, I have this genetic weakness, and everybody's so doom and gloom. And we used to think cardiovascular and recurrent miscarriages, and that's all we think about. We wouldn't think about all the other things that this particular gene does and how we can support it. But we check this word, this SNP, the SNP is a word. It's how I put it. So these little words that create your story. So we know how to support you in the best way possible, in the most optimal way possible. So your body functions. Is there still disease? There is, right? So right now, oh my goodness, what's going on? But if we can, here's what I tell docs when we're talking and they ask, how do I use this as a tool in my practice for my patients? What is the benefit to this? And I said, what you want to do is enhance recovery potential of your patients, how they recover from things. Are they going to be exposed to a virus? Quite possibly. Are we exposed to carcinogens on a daily basis? We are. But if our body knows how to respond to these things and we can recover from them in a healthier way in a shorter time frame, that's preventative medicine right there. And that's being proactive. So these little individual SNPs that make us who we are, that create our language, is our genome and our sequence too, that we look at.
Wow. So you swab. What do you look for in a lab? Like, what are your requirements? I know a lot of people are nervous about sending off their DNA. There's been companies that have sold it to pharmaceutical. So what is important to you?
So that's a huge thing to look into, to make sure that you understand that your lab is CLIA CAP certified, is HIPAA compliant, has their own software. So that way you don't have to worry about them sharing it with the government or whomever, the cloud, I don't even know who they share it with, people or governing agencies or pharmaceutical companies to be able to take your information and they, granted forbid, they might do good with it. But it doesn't get any more personal than your DNA.
Right.
Yeah. And that should be up to you, whether or not that's something that you're willing to share. So make sure that the lab houses its own software, has a backup for security, and is HIPAA compliant, meaning they legally cannot share your information. And I think those are the most important things.
Definitely a medical.
Yeah.
You want a medical grade
You want
lab.
a medical grade lab, absolutely. You don't want some guy in his garage processing your DNA. That might not be so good. Although a lot of famous people started in their garage, so I don't know.
As far as swabbing, do you ever have to re-swab? Do your genes change?
Got excitement on the back end with that one. No, you don't have to re-swab unless I actually had a patient recently, in fact, who we did a cheek swab on her, and I didn't swab her. It was my assistant who did, and she came back to me and she said, the swab was pink. I've never seen that before. And I'm like, pink? I'm like, well, let's send it in and see what happens. Did she eat? Was there gum or a mint or something in her mouth? No. So it ended up being rejected. She had denture gel in her mouth, right? So paste and glue to hold her dentures in. So that masked the DNA, and we had to go back and swab. But no, unless technology advances and they upgrade their chip or something else happens, you may have to re-swab in that case, but typically not. There are labs that look at a vast amount of SNPs, 600 plus thousand, for instance, where they can pull information so you do not have to be re-swabbed, because your genome sequence are not going to change.
Okay.
Your SNP variants, whether you're heterozygous, meaning you got a copy from one parent, you're homozygous, meaning you got a copy from both parents, or you're wild type, meaning you got a copy from neither parent, those aren't going to change.
Okay.
However, the expression can.
Okay.
And that affects how enzymes and proteins function, and how they turn other biochemical and metabolic reactions on, and how your body functions. So those can change, but the actual result of your SNPs does not
Change. Okay. So what you are born with, you die with. We could
That's
swab
a-
you at birth and
that's a-
swab you at death, and
a good
it
way
would
to
be
put
the
that,
same, same genome. As far
I'm
as
going to use that.
now,
Trish.
I like
yay.
it. Repeat it. Yeah, it's worth repeating.
As far as changing the expression, so that really means you talk to me about epigenetics. Is that what you mean by changing the expression of the
Absolutely.
gene?
So epigenetics is all about your lifestyle, right? So you can change the functionality or the expression of that gene, which affects the enzyme, which then affects the biochemistry and the metabolic reactions within the body, by the things you eat. You can't eat McDonald's all day, every day, and drink alcohol and smoke cigarettes, not eat, be in a terrible relationship, hate your job, you know what I mean? Have all these things happening and expect your body to function the way that it's supposed to.
Right.
You also can't fill it full of things that it doesn't know what to do with and expect it to function the way that it's supposed to. I always use the car analogy because I grew up as a car girl in a car family, and most people understand. Some people not past turning it on and going, but most people understand how cars work. We know what to put in our car because the manufacturer has given us this blueprint, this manual of how to do it. So we understand that. We know if we have a GT3 Porsche, we're not going to go put diesel gasoline in it. And if we do, it's probably not going to run the way that it's supposed to at its optimal performance. We're the same way. Yeah. So this gives us our blueprint to be able to say, here's what you put in your body.
Right.
And how much. So it functions more optimally. But you have to use epigenetics to support that.
So you're saying all the pillars of health, really. Emotional, physical, all of them. Okay, as far as, I just lost my train of thought. What were we just talking about? I know. What were we just saying? What was the last thing you said?
Epigenetics.
So that made me think of sourcing. You're talking about the gasoline. So I'm thinking about, there's a lot of supplements out there. A lot of nutraceuticals, or a lot of fillers, so what do you look for in your supplementation or what you would give in a nutraceutical?
So I tell everybody I'm very, very picky. And there's a reason why I'm picky, because for one, when you're dealing on a genomic level and you're looking at affecting how these enzymes function, you can't fill it with preservatives, and you can't have extra chemicals and soy and other things in there that the body's going to, okay, I understand this, but what if they interact in a way where the bad one takes over first and therefore the good can't be absorbed? So I look for, so I have formulated for many years. I've formulated for a lot of amazing companies, and I still do. We formulate I've formulated from plant-based to pregnancy stuff to, adults, kids, you name it, gummies. I've done it, and it's so much fun. But what we look for is quality of the ingredient, the source that it came from. Make sure that it came from a good source, a clean source, whatever they extracted from, whatever they freeze dried with, whatever they binded it with. There's how they broke it down is important. So we look into all of that. I want to know their C of A. Give me your certificate of analysis. I want to know all the possible toxin exposures and things that are in this so that we can make sure it is as clean as we can get it.
I love that.
Because I'm like, I can't work on a genetic level and give you garbage. I'm trying to take out the garbage, not put more garbage in.
And it seems like so many products on the shelves are garbage.
They are, and a lot of people have good intention and they want to create something and they do, and that's great. But they don't understand, for one, maybe the synergistic effect of when you put certain things together, or how it works when you are working on a methylation pathway, the exact things that you need. Or, with B12, using cyanocobalamin instead of methylcobalamin, or, looking at all those different things, and they just think, well, it's cheaper. We'll just put this in there because we can put a higher amount because it costs less. I don't care about that. We want to have a cost-effective product. We can't break the bank, of course, but you pay for what you get too.
Yeah,
you want to pay, and I don't mean to throw, I won't say a store name. You want to go to a general store and buy something off the shelf. I mean, seriously, read the back of those sometimes.
Yeah, I have.
I'm amazed at some of the things that they put in the inactive, and there's even a percentage of inactive ingredient that if it's underneath this percent, they don't have to even put it on the label. That's the other scary thing.
Yeah.
So ask. You should ask. Ask. You should always ask. I love it when patients come to me and say, what do you think about this? Have you heard of this? And let me see. I'll go look it up and I'll get back to you. When I look into it, a lot of it is not fully disclosed. You have to dig for it. I don't like that. But there's sometimes I'm like, this is a great product. Absolutely. It works with your symptoms. It works with your lifestyle. It works with your genetics. It works with your blood work. Go for it. I'm not going to say, no, you can't take this because I didn't prescribe it or I didn't recommend it. And other times they'll bring me stuff and I'm like, I'm sorry, absolutely not.
So you mentioned blood work.
Yes.
Difference between DNA testing and blood work.
Yes.
Tell me the differences there and which one is one more now focused and one's more overall picture? Or?
Oh, for sure. So blood work is still vital and important. It's a great tool for us to understand what the body looks like at that exact moment. So it's a snapshot. And that's what I love is we need to track to make sure that what we're doing is working. So you check, let's just say with genetics, you want the big picture. That's what it's the blueprint, right? So because they have a genetic SNP or variant, it doesn't necessarily mean that they've got a deficiency. So let's say they have the vitamin D receptor gene, which this tells us that the body has a more difficult time absorbing vitamin D, and they typically have to take higher amounts and make sure that it synergistically is combined with other nutrients. If they have the vitamin D receptor gene, let's say in a homozygous, meaning both parents gave it to them, so it's a plus, and you check their blood work and they've got a great level of vitamin D, great. They're typically taking supplementation. I've had gentlemen come in and say, but I work in the sun all day, doesn't that? No. You only absorb about the first 15 minutes that you're out in the sun. vitamin D, and it's not even the active form. The body then has to go in and convert it. And with that VDR SNP, it doesn't always work that easily. So typically they're supplementing. We have found in research and statistically that 95% of U.S. People in the United States are vitamin D deficient, 95%.
And that's without a genetic variant. That's just in general.
That's without any genetic variant knowledge whatsoever.
How many biochemical processes does vitamin D do on its own?
So very many. People don't think about it as a hormone sometimes too, and how it helps our hormone production, right? So helps with our hormone production, helps with our gut and our immune system, helps with our bones, helps with the skin, helps with, there's so many different things that vitamin D, depression.
Mm-hmm. Yes.
That's another big thing. Infertility, if I've got somebody coming in who's having fertility issues and we check 9 times out of 10, they have a low vitamin D. Cancer patients typically always have a low vitamin D. There's a lot of things that it supports. Again, it's just a vitamin, right? It's just a vitamin.
Building blocks. Sorry.
Do you work, so vitamins, minerals, there's definitely SNPs for all of those. What about medicinal herbs? Do you work a lot with herbs?
I do. I think that they are supportive. I like adaptogenic herbs.
Okay.
So adaptogenic help the body function more properly, whether you're excess or deficient. They're taken for more short-term time sometimes as well, or they can be taken daily. Think about things like astaxanthin, ashwagandha that help support the immune system, that help support how the body functions. Ashwagandha helps produce testosterone in men as well. It helps your sleep. It helps with your mood. It helps with so many different things. So natural herbs, I believe, are, and that's another thing. Oh, it's just an herb. It's just a plant, whatever. But they are so powerful. So if you give somebody the wrong type and the wrong amount that's not specific to them, you can make them feel a lot worse. But if you give it to them in the right amount, the right type, at the right time, they're going to feel fabulous.
It's so exciting that we can even do this.
It's amazing.
It's amazing. So I'm going to look at some questions on the board that we've been put up from Facebook. What is mitochondria?
Oh, my favorite thing. Somebody must know. Who asked that? Somebody must know. My favorite thing in the world to talk about. Mitochondria, powerhouse, ATP, cellular energy, brain function, heart function, kidneys, liver, bones, muscles, you name it, mitochondria. If we have weak or poor mitochondria, our body will not function the way it's supposed to. So our muscles require a ton of mitochondria.
Okay.
So you think about things like MS patients.
Mm-hmm.
You think about patients who have muscular atrophy, muscular dystrophy, things where their muscles are either very, very weak and they can't build muscle. It's very painful for them as well. The brain needs a ton of mitochondria. Most of mitochondria is held in the frontal lobe, believe it or not. We look at fertility because there's a lot of mitochondria housed in the ovaries in women. And so that's something I don't think anybody ever thinks about. And I'm going to give my secret out when I'm working on kidney patients. So I see a ton of kidney failure, kidney disease, diabetic patients. They're my favorites. They're my absolute favorites because when they see a change in their diabetes and their kidney functions increase after they've been told they cannot and they're going on dialysis, they are grateful and will do anything you ask them to do. And they're amazing and they're so appreciative and they're literally my favorites. To treat kidneys and help kidney functions, I work on the mitochondria.
Interesting.
Because the kidneys need so much mitochondrial energy to function. So that's one of the things that I look at.
Wow.
So kidneys, liver, muscles, brain, fertility, it's putting energy into that cell to be able to properly do all of our organ functions, muscle functions, thinking functions. Poor mitochondria will make us feel brain foggy and tired, and just like we can't properly function and do anything. So if we have strong, good, healthy, young mitochondria in there, those are the butt kickers, to be honest with you. Those are what help you kick butt every single day.
Is there an actionable SNP that's related to mitochondria function?
There's a lot of them.
Yeah.
So there's a percentage, it goes down a line, that says the efficacy of your mitochondria based on your genetic SNPs. So we look at it from anywhere between a 10 to a 20% knock, if you have, meaning a decrease, if you have a particular variant. I think the one that most people are aware of, and it's probably the powerhouse or the heavy hitter of that grouping, is ATP5C1.
Mm-hmm.
And when I was teaching at a convention to some personal trainers, health coaches, and things like that, I was telling them, you've got somebody who has, those are your batteries. Mitochondria, if your phone gets low on your batteries, are you going to plug it in? And if you don't, are you panicked when you see anything less than like a 10%? You're like freaking out. That's your entire life right there. Like, I have to plug this in. Your body needs battery charge too.
Yeah.
Like, we don't think about that for some reason, but no, being able to support healthy mitochondria, look at that ATP5C1, that is a heavy hitter, although there are many of them as well. When we see mitochondrial disease, or we see a decreased efficacy within the mitochondrial genetic SNPs or variants or sequencing, a lot of times it's kids that have had issues with autism, learning disabilities, growth development issues. Mitochondria comes from our mothers.
So fascinating.
So you, your mother, your grandmother are all going to have the same type of mitochondria.
Huh. Okay.
So be sure to, that's why pregnancy, when you're pregnant, right? It's really important to take care of yourself. You're passing all these amazing things down to your child for growth and development and for all these proper things. So that's why we coach pregnant women too, that this is how you should take care of yourself so you have a smart, strong, healthy baby and child.
So we talk about variants, and I've heard people say mutations. What is it, the same thing? What if it is the same?
There's a lot of different language. So variant, plus, minus, plus, negative, wild type, heterozygous, homozygous, green, yellow, red, it's all the same thing. It just means that there's a variation. It's not the standard norm.
Okay.
We're 99% alike, and that 1% is that mutation that sets us all apart.
Right. So I'm thinking too of, as far as a lot of things are, as far as SNPs and actionable SNPs, is we talk about filling in the gaps. I've heard a lot of mention of filling in the gaps. Is that
cracks in your foundation? Absolutely.
Yeah. Is that something that you have to do daily? Is this a one-time thing, a monthly thing? Like, how often do you have to fill in those gaps?
This is every day, all day, every day for the rest of your life.
Okay.
There's going to be things that you can take seasonally. There's going to be things that, during winter time, we're going to kick up our zinc and our vitamin D and all these things to support our immune system and to help with that melancholy because it's not as sunshiny like it is now, or hot. My goodness. But what was the question?
How often do you need to fill in
I digress.
your gaps?
So think about things like our detoxification pathway, right? So we have some big heavy hitters in our detoxification pathway. So what that means is we're looking at glutathione. So glutathione is the master detoxifier in all of our cells. It takes out the garbage. Here's why you have to constantly fill in the cracks. You can't be 100% of the time. I don't care who you are. I'm not 100% of the time. But regardless of that, we can't control certain things. You walk outside, you take a deep breath. Who knows what you're breathing in, right? Flu season and the pandemic going on nowadays, right? You want to be able to detox from those things. Us women put on over 150 chemicals on a daily basis to look the way that we do. Now, and that's shampoo, lotions, you name it. Mm-hmm. We can use more natural products. That's great, but that doesn't mean our body's always going to tolerate it. Alcohol, it's okay to have a drink in moderation here and there. I'm sorry, people. I know. I hurt a lot of people's feelings when I'm like, okay, guys, and it's okay to say, darn it, today's a chocolate cake day. I want a piece of chocolate. It's okay to do that every once in a while. In moderation, I see hands going up in excitement back there.
Dark chocolate, it's an antioxidant.
Dark chocolate's an antioxidant, which supports detoxification pathway, right? So we want to always make sure that we're constantly supporting those systems, because a lot of people have either a decreased ability to be able to create glutathione, which detoxifies these cells, or they are unable to clear carcinogens effectively from the body, or they're unable to decrease oxidative stress and free radicals on their own. High levels of oxidative stress and free radicals equals inflammation, equals autoimmune, equals not being able to overcome our genetic weaknesses. It does a lot. So if we are understanding this in the first place by checking our genetics, but also supporting that, whether it's by nutritional supplementation and taking the right things for you to help. Like, how do you know if it's you have the inability to clear carcinogens? That's something totally different to treat than if you are not able to produce enough glutathione, or if you were not able to help decrease your oxidative stress and free radicals. Those are three totally different things. We cleanse the brain. Think about anesthesia. How many people have had anesthesia and multiple times? They used to say the blood-brain barrier was off limits, and now they realize, whoops, nope, not really. That's where Alzheimer's and dementia and all these brain conditions, epilepsy, all these things are Tourette's, all these things are coming from. If we know there's a gene, GSTM3, GSTM1, there's genes that help us know that we can cleanse the brain on an effective level. And if those are hindered, if we have a variant, a mutation, whatever we want to call it, within those genetic SNPs, and we have anesthesia, I look at my patient and say, okay, before you have this surgery, because it happens, whether it's elective or it's not elective, come in and see me. Let's do glutathione injections. Let's make sure on a daily basis, up until that you're taking glutathione to get this, your body ready. Afterwards, we're going to do glutathione IVs. Let's clear this out of your system.
Yeah.
On an easier, help your body do what it's not able to do, because you can't change that.
Yeah. So it almost would be, if you had a mutation and you had a gap that needed to be filled, it would almost be like, personally for me, after I saw my genes and I have researched it enough and talked to you enough, I know I don't skip my supplementation, and I try to eat as clean and do all the epigenetics exercise, but daily, as much as I wouldn't skip if I was on an anxiety med or a prescription pharmaceutical. It's
a constant introduction into your body.
Yeah, it's like,
And medications get into the brain. That GSTM3 SNP helps clear not only environmental toxin, pollutants, and chemicals, but medications too, anesthesia, different medications that we're taking. And if we're not able to clear those on an effective level, they can cause oxidative stress and damage in the brain. And therefore, then we're looking at neurological progression and disease. And goodness, no, we don't want that, right? Yeah. I tell everybody, if my brain goes, I might as well just off myself. And not really, I'm not going to do that. But you know what I mean? Like, for me, brain function and power and dementia. And I wrote an article about this recently, and it's literally the most sad progressive disease for the patient and for the family. Yeah. And I don't ever want my children to come into a room and I'm going to get all teary, and me not know who they are, ever. So I'm going to do everything I can to support that. And that's what this is about.
Is that why you do? Why do you do what you do?
That is a big reason, because I want to be the best damn mom in the world, and the best damn doctor in the world, and the best damn Jen in the world, and everything else that goes with that. I can't function at an optimal level. And I've been there. Mm-hmm. My thyroid is gone. I don't have a thyroid. They ablated my thyroid when I was 18 years old because I had Graves' disease and I weighed 89 pounds. Mm-hmm. And I didn't know any different then. I was in nursing school. I was like, oh, this is what I'm supposed to do. I'm supposed to have my thyroid taken out. Couldn't be around my anybody in my family for an entire week. I was like stuck in a room. It was terrible. And I've had, GI issues and had to have surgery for that. And I tell you what, I would say that the last 10 years of my life, I can do all the things. And that's what I want everybody, whatever that means for you. I don't care if you're a housewife. I don't care if you're a career person. I don't care if you're just out LIVIN in life and just living and enjoying yourself. You need to do all the things. And that's a huge thing for me, is that my patients come in and they say, you know what? Yeah, I have more energy. I feel better. Are there always little tweaks and things? Absolutely. Yeah. I mean, I don't always have 100% days, and that's okay. But I'm so aware that I know my triggers. Mm-hmm. And I'm like, that's why I don't feel so great. But I want my girls, and they do, and they look at me and they think, okay, I'm at a friend's house and here's all this junk food. Oh, my mom would kill me right now. But she also says, I'm a kid, I live a little, it's fine. But I see my daughter pick up a box at the grocery store and read the label and go, and put it back. I'm like, oh, parenting win. All day long, parenting win. But to be healthy and strong and not be, Mom, I can't today. I have a headache. I don't feel good. My mood, I'm depressed. I don't ever want to be. Nope. So it's a lot for them. It's a lot to keep them healthy and our next generation healthy as well. It's understanding how our bodies function. That's literally all it is. Understanding how our biochemistry, our metabolic, it's biochemistry, it truly is, how our metabolic reactions occur, how they happen, where our weaknesses are, and supporting them the best that we can.
That leads me to think about we are the sickest generation. That has been stated. We're the sickest generation. Is that true in your opinion? And why do you think that the predispositions are coming earlier and earlier?
I actually think our children are more sick than we are. Not mine.
That's sad.
But children, right? And it's only because I torture my poor daughters. No, they're great with taking stuff every day and eating the right way and getting fresh air and exercising and not being, playing the entitled victim role and everything else, and being a powerhouse and going after things. So, but no, it's true. This is a very, very obviously, this is a sick world right now. Mm-hmm. That I can honestly say I've had 0 patients test positive for this latest pandemic. Mm-hmm. 0. And I'm not bragging, not at all. I'm just saying that they've listened to me and they've taken the authority on their health and they went home and they said, I'm going to do this. And their immune system, here's this virus. I mean, our natural innate immune system says, I recognize this. I need to do something about it, fight it off, decrease inflammation, have all these helper T cells and white blood cells and everything go after attack this. And then, it's gone. Good. Let's go back to homeostasis and do our thing. Keep on moving. Could we get a runny nose, a little cough? Sure, it happens. But we don't have to let stuff take us down anymore. So I think it's all about just supporting your body because that's what it needs. You know what kind of gasoline to put in your car. You know what kind of oil to put into it. You know if your air pressure in your tire is low because your light comes on. If you're aware of your body, and that's all I want to teach. I want to teach my patients to not need me. I want them to understand how their body feels and functions and know something's not right. You know what? She did tell me that when I feel this or when I experience this, that's what I should do. Okay, I'm going to do it. Oh, I feel better. Awesome. That's a big and a very important thing for me. So yes.
So we're talking a little bit about the virus, which everyone's talking about.
Everybody. I almost don't want to talk about it anymore. But
well, let's talk about how. So there's a couple of questions I have here. One is supporting your immune system. Mm-hmm. What does that look like? What does that look like to you?
It's different. It is different. And here's why. As I was saying, we've got an innate immune system. It's supposed to react to things. But when we learn about everybody's genetics, we can understand if they have a more aggressive immune and inflammatory response. So let's say I walk outside and I twist my ankle. Mm-hmm. My body goes up. We got to fix this. So let's cause inflammation. That's why it inflames itself. Let's send all these white blood cells and everything and red blood cells into this area. Let's repair it. It's all done. Let's go back down to normal and we go on about our day. But when we have certain genetic variants, IL-6, CD14, TNF-alpha, IL-3, IL-13, NOS2, I could go on and on. If we have these certain markers, we tend to have that more aggressive, it's like getting a bug bite and it blows up into something bigger. That's what happens on the inside of your body. Whether it's a food that you eat that you're intolerant to, whether it's a virus that we're exposed to. The body, it's like when you have these genetic variants within the immune and inflammatory response and it's aggressive, I tell everybody it's like burning down the whole neighborhood to kill one bad guy.
Mm,
That's what your body does.
it's a really good analogy.
So it doesn't, it almost, it's like the oxidative stress suppresses the immune function. And therefore, whatever is coming at us is 10 times worse than it should be. So if we can restore how the immune system and the inflammatory response reacts to things, it's still going to get this exogenous threat. But if it's restored and it's a healthy response, it's going to be the ability and for it to optimally get rid of or process or eat or whatever it needs to do with this threat, it's going to do it more efficiently. And that's what immune system and inflammatory response means to me. It's not suppressing the immune system or, oh, now we're sick, let's give a bunch of antibiotics so we kill the microbiome, which is 70 to 80% of your immune system. Mm-hmm. No, it's let's be proactive and preventative and work on the immune system before anything even happens.
Exactly. It's not an event, right? It's a habit, something daily. I love that.
It's definitely a habit. I like that.
Okay, corrections. So if taking corrective action on our genes, how long is it instant? How long does it take?
Great question.
Usually?
We were talking about this earlier, in fact. Good question. So the cells take about 120 days to regenerate. So it takes 3 to 4 months. So somebody, that there's that person. There's always that person. Doc, I took this for a month. I took this for 2 weeks and I didn't feel it didn't do anything. So I stopped taking it. Okay. So you're going to put gas in your car once. And then when it runs out of gas, you're going to be like, well, what do you mean? Why can't I drive anymore? I don't understand, So, no, you have to constantly your body needs all this stuff like we were talking about, filling in the gaps. You constantly have to remind the body, this is what you need to function. This is what you need to be optimal. This is what you need to enhance your mitochondrial function, to support your detoxification pathway, to support a healthy immune system, to work on your methylation, to precursor RNA and DNA, to repair DNA. Those are all things that it needs to do constantly, but you need to be on something, hopefully a genetically guided nutraceutical of some sort, something that we understand that we are supposed to take. We have found in researching clinically that over 75% of patients have a genetic variant in one or more of the most important nutritional pathways in the body that affects the biochemistry. Over 75%.
That's a big number. So
we do have to take this constantly. I usually recheck blood work in 3 to 4 months. And we typically always see a change. And there might be something else we still need to work on, and that's great. Yeah. But we see changes, and that's what's important.
Yeah. Okay, there's some more questions coming in here.
Ooh.
How is the brain and body, gut-brain connection?
Brain number 1, brain number 2. I mean, there's a huge connection. All neurotransmitters are produced and housed and started within the gut. Think about it. When somebody has a gut issue and they come in and see me, 9 times out of 10, there's an emotional component behind it. 9 times out of 10.
Okay.
And that's those gut inflammatory conditions too, like ulcerative colitis, Crohn's disease, celiac. There's genes that'll actually tell me if they're going to be predisposed to these things as well. We're looking at autophagy genes. We're looking at FUT2 for microbiome. We're looking at AOC1 for histamine response in the body. So these are things that we can see if there's going to be an issue where they can't maintain proper microgut biome in the first place, which then affects how neurotransmitters are produced, and affects how the brain functions. Where everybody like, oh gosh, when I eat something, this is me. If I eat something, even if it's too much fruit, something sugary, talk about brain fog. Talk about feeling like I'm drunk. Talk about feeling like I'm like, or you get a headache if you eat a certain thing. They are vastly connected. We don't take care of one, the other one's going to be sick as well. 70 to 80% of our immune system is housed in our gut. And the health of our brain is very dependent on how our gut is functioning and our microbiome.
So if you had overgrowth of something like a bad bacteria, definitely would affect.
Brain fog, big time. Brain. Absolutely. So, and that's why when we detox a lot of times and we do these different, you go online and click in detox, you're going to find a million products. But when people go in and detox, they're like, I feel like I have brain fog like crazy. These bad little critters, or they don't want to die. They want to stay in there.
Mhm.
They love sugar. Oh, they love sugar. They love carbs. The more you feed it, they're having a party in there. You take that away from them and they're like, nope, I'm going to make you crave it more just so I can continue to live. Well, when they die, they release toxins.
Mhm.
And it makes you feel yucky, but it's good. It's good. And make sure we flush it all out. But there's a huge connection between the gut and the brain. Keeping healthy microbiome, keeping the gut healthy, keeping the immune system healthy will affect or enhance how our brain functions. Because I know I want mine to be 110% of the time. So
I do too. I have that FET2 one that you talk about, and that was one of the genes that I felt gave me answers to symptoms I had forever. Was the gut one. So we talked
which affects your, I think this point's a good one now that you mentioned that, which affects your nutrient absorption, because a lot of them are absorbed within the small intestine, right? So if they're not absorbed properly within the gut, they're not going to help. B vitamins are so great for the brain. There's so many different things that are great for the brain and the nerves, and but they have to start somewhere. So if you're taking a pill, the gut has to be healthy in order to absorb it.
And like one thing's linked to another, right? That was a link to my anemia, which is it just kind of.
It's like quantum physics. That's what I tell people. It's not you're not looking through a microscope or just looking at a particular thing. You're looking at how the whole body functions to be able to support that, because it does. And that was some of the cool stuff that I got to learn, when I got my doctorate in Oriental medicine. Blew my mind. I never thought I would go into Oriental medicine, but I'm glad I did. It taught me a lot about how the body functions and how it functions as a whole.
Yeah. Okay. Looks like there's another one.
Good bacteria versus bad bacteria. Is there a percentage in general, or?
You do want a particular amount, and it depends. It depends on. So that's always my answer. I'm sorry. It depends. There's a difference with everybody. Of course, we want the good to outweigh the bad. Always, always, always. And we want healthy amino acids and different things that are housed within the microbiome besides just good and bad bacteria. But if the bad bacteria outweighs the good, small intestine bacterial overgrowth, or SIBO, yeah, it's going to cause problems to how our immune system functions, to how our body feels. We're going to feel icky. So we definitely don't want, the ratio depends, Craig, that was a good question, but it depends on the individual, and it depends on if they have the ability to maintain healthy microbiome in the first place. So.
Weight management and genetics. How is that affected? And is it actionable?
It is, along with everything else. Everybody wants to blame something, right?
Mm-hmm.
Well, it's my genes. I'm overweight because my genetics don't function properly. Those enzymes don't function properly. Think about the fat mass and obesity gene, FTO. So FTO has a really good correlation of ghrelin and leptin and their relationship. Mm-hmm. Ghrelin, I always tell patients, think of like ghrelin, hungry. Leptin is telling you that you're not hungry. So within the FTO gene, they have a harder time shutting ghrelin off. So they think that they're constantly hungry. These are the snackers, the people that just always feel like they have to eat. Mm-hmm. And they may not be overweight. I've had people that they come in to have that gene and they're skinny as can be. That's great. They have other factors in their life that's helping them with that. So that's good. But they can have the tendency or the predisposition to be overweight. So it's a behavioral thing as well. But understanding that lets me know, okay, I'm going to have to work with this patient differently than I would somebody else who wants to lose weight that doesn't have these particular genes. It just helps me be personalized and precise a little bit more instead of just throwing darts at the board and guessing. I'm not a gambler, and I don't guess because I'm not good at either one. So for me, it's more about understanding exactly somebody's blueprint so I can navigate that. It's not I need to know your lifestyle. I'm nosy. I want to know what you do for a job. I want to know your family history. I want to know what you eat for breakfast, lunch, and dinner. There are so many other things involved in that. How your stress level is, what helps you decrease stress. If I don't support you in a way that's sustainable for you, you're not going to do it. Like if I said, Trish, you need to go home and eat bananas all day, every day. You're like, but I don't like bananas. I don't care. Go home and eat bananas all day, every day. You're not going to do it. not going to be sustainable. It's not going to work. And therefore, you're going to feel like you did not get the most out of what we're trying to do.
Yeah. I love that you look at the whole picture and get to know your patients too.
I love my patients. I love their
Spend
stories.
time with them.
Their stories are my favorite.
Yeah. You learn from each other's stories, that's for sure. Is there any other questions coming in on Facebook?
ADHD, autism?
It is. It is. There's other factors involved in this, and I'm probably going to get into a topic that's very sensitive right now.
Is ADHD, just read the question.
Is ADHD and or autism genetic?
Yes. There's other factors,
There's
right?
other factors.
So it's not fully genetic. I would not say that. So when we look at, like I was saying with mitochondria, I can see if there's somebody could possibly have an issue with developmental brain, things like that, based off their mitochondria. COMT is a particular gene that tells somebody, works on epinephrine and norepinephrine. So that's ADHD, that's hyperactivity, that's the warrior gene, which is great. And I spin it to my patients in a positive way. I'm like, you're going to get stuff done. You're a friggin' warrior. You're the kind of person, though, that has to keep the mind and the body active, or else you start to get anxiety and you get overwhelmed and and then you're pacing and then you don't get anything done, right? That's how it works. So yes, there are other factors. You give children, you know him. One of my favorite patients ever had Tourette's. And he came to me and he was overweight and he had tics so bad it broke my heart. It looked like he was going to break his neck. I was just like, I don't care. I'll treat you for free. We need to help and make you better. He transformed himself so incredibly, but it was a genetic thing. He had an overstimulated central nervous system, which caused the tics and can cause anxiety and can cause insomnia. Here's the sensitive part. By the way, he doesn't have Tourette's anymore, and he'll tell you that too. He lost over 100 pounds, and he's a rock star. So he's amazing. And he's a health coach, which is even better. So Now he helps other people go through what he went through. He's a total rock star. But when you look at oxidative stress and triggers, something triggers the body to do what it does. It doesn't just happen, right? Whether it's emotion, trauma, medication, food, doesn't matter. Something triggers the body to do what it does. If you have somebody or a child who has an aggressive immune and inflammatory response, again, burning down the whole neighborhood to kill one bad guy, and you douse this child with vaccinations, yeah. I don't think that's the only factor. And I'm not saying I'm anti-vax. I'm just saying that if you understand that, you know that you can look at the schedule and do things a little bit differently. That's all I'm saying.
I agree with that for sure. Dr. Jen, what is your advice to everyone listening? What advice do you have for everyone right now in these times?
Oh, yeah. Get a genetic test. Nutrigenomics, pharmacogenetics, get a genetic test, right? And whoever invited you here to this amazing webinar, Zoom, Facebook Live, contact them. Talk to them, find out how they knew about me, how they understand how this works, and be proactive. Nobody's going to make you feel better except for you. And you have to understand what that looks like. I'm going to help you feel better. Of course, there's other great providers and doctors that are willing to do the exact same thing, but you have to make that first step. Getting nutrigenomic testing, having your blood work done, making sure that all those factors within your life are healthy. And life does this, right? Mm-hmm. But during this, I want people to go like this. Nobody wants that up and down. That's nauseous. Get me off this ride. I'm done. I'm tapping out. Yeah. But if you can your body can be stable, you can get through those things. Again, it's working on overcoming how your body recovers from things, enhancing your recovery potential. That's what it's all about. So look into nutrigenomics, nutrigenetics. It's proactive and preventative. It's not witchcraft. It is the most scientific thing that we can do, because it's looking at your body from a biochemical standpoint and how your body absorbs these nutrients, how it utilizes it, and how it excretes them. that's really important, right? And understanding what type you should take, how much you should take, what's appropriate for you. So get some testing done. Talk to whoever invited you. By the way, thank you all for listening. Take your power back. Snatch your power
It's
back.
not a weapon. It's a tool to have that
That's
information,
what I love
right?
to say,
It
yes.
is a tool.
Genetics should always be used as a tool, never as a weapon. Don't let them come after you with disease-based genetics. That's awful. Nobody wants to hear they're predisposed. You are predisposed to breast cancer. I'm sorry. Get your mammograms yearly. You're predisposed to type 2 diabetes. I'm sorry, get checked. Don't eat a lot of sugar, maybe exercise. No, we can be so proactive and preventative with these things. So proactive preventative medicine is the future. It's here. It's not going anywhere. So become aware and snatch your power back. Take control.
I love that. Thank you for spending this time with us tonight and
of course.
all your expertise. Thank you for tuning in live on Facebook with us tonight. And if you like what you saw, feel free to share this with someone that you care about. This live is being recorded, right? We can share this.
Right
Thank
here.
you for coming.
Thank you all. Yes.
Appreciate
yes,
you and your
appreciate
time,
all.
Jen.
Thank you.